Hey guys, thanks for tuning in to Mind Hostage, a show where real people discuss real issues of overcoming negativity and a negative mindset. I'm your host, Stephen Payne, and I'm glad to be here with you today. Today's episode is brought to you by CBD 911, distributors of one of the purest CBDs on the planet. Don't trust your health to inferior CBD products with fillers and pesticides. Look up the CBD experts. You can email with questions at mycbd911@gmail.com or shop on their website at www.mycbd911.com. Also, see our sponsors, Four Legs of Love Boarding and Boutique if you're in Central Texas area. They take wonderful care of your pets and offer full spa treatments and pet CBD. You can look them up on GoPetLove.com. With as little as $5 a month, you can help us to continue to bring this program to folks who are struggling through adversity. You can look us up on www.mindhostage.com and click on the Patreon icon. Well, I want to thank you for tuning in, Mind Hostage fans. I'm excited to welcome our guest, Dr. Tania Glenn, today. Tania, I can't tell you how excited I am to have you on the show.
Thank you so much. It's an honor to be here, and I'm so excited to be on and to talk to you about all the things we do and all the work we do in healing the mind.
Well, I can tell you something. You know, we haven't met formally in person, but I just want to share with my fans that the first major impression I got with our discussion over the telephone was how amazed I was at the pure passion in your voice and your conversation behind what you do to help our first responders and military and folks that are in need of healing.
Well, thank you. I always say that I have the best patient population in the world. I mean, really, you can't beat it. You know, the honor of helping the helpers is the most incredible job I could ever ask for. And it's to me, it's not really a job; it's a passion.
Well, if you don't mind, sharing with our listeners and fans, just kind of go back a little bit when you got started and kind of what developed the passion to help folks like you do.
You know, it started, I was actually about 3 months away for finishing my master's degree at the University of Texas. And I just didn't know what kind of therapist I wanted to be. You know, nothing really appealed to me in terms of what they were offering us. And I just, like, nothing was sticking. And I went home on a Sunday afternoon and I turned on the news and I proceeded to watch the ATF raid on the Branch Davidian compound in Waco, well, outside of Waco. And I knew that day that my calling was to work with law enforcement, fire, and EMS and go to high velocity events like that and to go help the helpers. So it was just immediate. Like I knew that day. So I went to school the next day and I informed my professors that I was going to work with high velocity events and police, fire, EMS, and they told me I was crazy. So here I am 27 years later, still as crazy as ever.
Well, that's awesome. Well, I can tell you something else that I noticed, and kind of doing a little bit of research and background on you is everywhere I look, I see you not only talking the talk, but walking the walk. I've seen photos of you with firefighters and out with calls and with EMS crews and with law enforcement. I see pictures of you hanging out with kind of aviation folks and jets and helicopters. And tell me about that.
You know, I knew right away that the way into the hearts and minds of first responders was to go out and ride along. And for the first 10 years of my career, I was working at a level 2 trauma center here in Austin. And I did a weekend night shift. That was my shift. And during the week, I had my little practice that I was growing on the side with first responders. So every Thursday night, to flip my schedule back to night shift, I would go ride. And the incredible rapport and credibility that you gain from doing that is phenomenal. And really, to do what I do and to be at a practice like mine, you have to have ridden out. You have to understand the terminology. You have to understand that hours of boredom followed by moments of just sheer terror that is the typical first responder sort of shift work. And it's just so important, meeting people where they are and the ability to connect with them where they are is huge because, most first responders don't want to come to therapy, but when they've seen you ride along, they're more likely to make that call.
No, absolutely adds credibility. I can tell you, having spent, over 30 years in the industry, that it's a tough crowd. And that's one surefire way to connect with these folks is to actually, be a part of what they do. And they know you get a deeper understanding of kind of where they're coming from. So I applaud you for that.
Thank you. I do love it. I mean, who doesn't want to climb ladders in Quince and get I just love it.
I'm looking at your profile picture now. Yeah, and you're way up on top of that ladder. So apparently you didn't go into it with a fear of heights.
Well, they told me don't look down. Whatever you do, don't look down. So I followed those instructions and I never looked down.
Nice. Well, having spent as many years in the industry as I have, and I can tell you both from a caregiver standpoint and a manager standpoint, I've done it wrong. And I maybe didn't recognize some of the symptoms I had from some of the injuries that I had incurred over the years. And again, as a manager, although I was dealing with a lot of kind of human resource issues with folks that were going through, a lot at the time, it was just kind of an unspoken thing that people in this arena and police, fire, and EMS just were certain personality types, and all of our lives were fouled up. And so, the biggest thing that I found over the years is working to break the stigma. Do you find that to be still a major issue?
That has been the challenge my entire 27-year career so far is the stigma. The culture, when I first started, the culture was very much suck it up and don't talk about it. And people would really only come in when they were broken, like completely broken, usually backed into a corner in trouble, on some sort of, PIP or some sort of, disciplinary action. That was the majority of my patients in the first several years. And I think most recently, there's been a lot more awareness of trauma and stress and PTSD, but still a lot of fear. And the problem is that some departments and some leadership are still punishing their folks for getting help. That's actually why I created the documentary, which is called First Responder Resilience, Smashing the Stigma. It's actually loaded on the website, smashingthestigma.com. And I wanted to just feature how proactive and productive it can be when first responders get help. But you have to have the leadership behind that because, this documentary features 7 people who walked through hell and back. And they never were punished, and they were really encouraged to get help, and they never lost their job, and they were never taken off the line. But that has to be a cultural issue within each department as we push for widespread cultural issue, sort of tempo in all of police, fire, EMS. We really want it to become the norm versus the exception.
Yeah, for sure. I've seen so many people who were just very compassionate caregivers and were really good at their job, yet their career was cut short either because they didn't reach out for help or, perhaps back at that time, they did reach out for help or show symptoms and they were labeled, maybe weak or something. And I've seen way too many careers cut short because of this stigma.
Isn't that amazing? You have these stellar performers who are so skilled and, especially, with medical providers and even, law enforcement, fire, you see these incredibly talented, compassionate people who are dealing with the public on the worst days of their lives, yet somehow they're supposed to go into that situation and be completely immune. What I always tell people is, behind every vest and behind every uniform is a heart and a mind, just like the rest of us. These people aren't robots and they're not sociopaths. So they're gonna at some point be impacted, and that's called normal. It's amazing how you can train someone and you can provide them with a bunch of resilience tools and you can, get them gradually desensitized to a lot of things, but everybody has their limit. And, your limit, whatever point that is, if something is pushed past your limit, you're going to have a reaction. And to me, that's completely normal. I think in the culture for a long time, it's been, oh, that's bad. You shouldn't have that. And I just think that's ridiculous.
Well, I've seen folks over the years, and I knew there was something going on, and I knew they were good people, but, maybe they didn't know they were going through a hard time. And, a lot of folks would just label them as burned out or, just crotchety or, just hard to get along with. Yet, there was a deeper underlying issue, which kind of brings me to maybe what are some of the signs and symptoms that folks can look out for if they're not sure they're in trouble.
Absolutely. What I tell folks all the time is, so we have two things I want to tackle. The first is resilience and in terms of burnout, and then the second is post-traumatic stress disorder. So burnout, basically, that's a tricky one. It's a slow simmer to a boil, and boy, it just wreaks havoc on people's lives, and you really don't see it coming. The biggest thing about burnout is that we are continuously exposing our first responders to human pain and suffering and criminal activity and violence and, awful things happening to children and the innocent. And, they, like I said before, walk into the worst days of people's lives. And over time, what happens is people lose their balance. When you take those bad calls and you add on the shift work and the holidays and the weekends and the fact that first responders tend to want to, and rightfully so, circle the wagons and just kind of hang out with like-minded, they can never really get away from work. And what I always tell first responders is when you see people on the worst days of their lives, you forget about all the happy, healthy people who don't need you. And you drive code 3 right past their houses, and it's hundreds or even thousands of people who are just saying a little prayer for you, hoping you're okay and safe, but they don't need you. And so we don't interact with them. And over time, we tend to get like a really skewed perspective. Like a lot of times what I hear is everybody's a scumbag except for police, fire, EMS. And what I remind people is that's simply not true, because there's a lot of good people who just don't need you. And, and I think sometimes the media does a little bit of damage. It makes the public really misunderstand first responders. So they're even afraid to approach them in the grocery store or in a parking lot to say thank you. It's a very, very tough time. The further first responders get alienated and isolated from the general public and the happy, healthy people who really appreciate them, the more they get that skewed perspective that life is bad and people are bad. So what we do for the burnout is we really work on restoring resilience, which is your life outside the job. It starts with hydration, nutrition, rest, and exercise. And then we get into your family, your faith, your friends, your hobbies, your life outside the job, and really kind of reconnecting with those old friends that you haven't talked to in a while. And, I always say you train those old friends not to ask you what's the worst thing you've ever seen or, anything like that, because you don't want to go there with those friends. You need a break from that. And so we're giving first responders permission to have a life outside the job, which is going to be the biggest combatant for burnout. Then there's post-traumatic stress disorder. So what I teach all of my customers, and I teach my peer support teams to interact with everybody at that line level, is that when you go through a bad call, you're going to replay it over and over again. It's like a video in your mind, what you saw, heard, tasted, touched, and smelled. And for the first few days, that's really normal. And what we're looking for is by the end of 7 days post-incident, we want that call starting to fade. And at 14 days post-incident, we want that thing banked in your long-term memory. In other words, you might never forget it, but you don't see it, hear it, smell it like you did on days 1, 2, and 3. Ideally, the nightmares have stopped as well. And I tell folks, if at 2 weeks you're still replaying it, it's triggering you, it's this pervasive movie in your mind, and you're having nightmares, get help, because at that point, it's all prevention. We have PTSD figured out so well that what we're finding is that when we intervene quickly, we can actually mitigate it. If it pushes on to PTSD, you'll know you have it because you're completely, constantly triggered all the time. That when people have full-blown PTSD, what happens is it realigns the limbic system and things start to misfire. So that your amygdala caveman tells you to fight and run all the time, and it's based on a smell or a sound or something that seemingly innocuous will trigger you into motion. And people spend all this time trying to stuff it and hide it and forget about it, and instead what we want them to do is get help. And it has to be good, competent help, but to get help, the quicker the better, but it's never too late.
Well, I always used to tell myself I was okay, and I think I was like a lot of folks in this industry where, I don't know what you call it. I call it compartmentalization, but we're good at running through those calls or events and putting them behind us and kind of locking them away. And one of the ways I characterize that, for myself is it's kind of like locking away a 50-gallon barrel full of nuclear waste. You can seal it up in a barrel and you can dump it and surround it by concrete and bury it, but eventually it's going to leach out. And I think that's what I found for myself, where I told myself I was okay. And a lot of people say, no, I'm okay, because, I wasn't showing any signs or symptoms right now. But the further I got down the road, these things started to leak out. I started having these triggers and things that I didn't really understand and correlate with something that happened years ago.
Right.
Is that
right.
something that you find?
Absolutely. And, at the time you are okay and you just kind of lock it away and you brush it off and you keep going, and there's new calls and new distractions and new shifts and all those things are good distractions when you lock it away. But usually what happens is, if your brain hasn't processed it like it really needs to, it does come back at some point. And so you may lock away multiple events over the course of years. And then suddenly, when you have basically reached your limit, and it's usually when your resilience is at an all-time low, it just comes back. And so that's that cumulative stress that we're looking at. And then all of a sudden it impacts you. I will say also, though, one of the things that contributes to that is, as we get older, we get more mature, we have more compassion, we see the bigger picture. And some of the calls that we sort of lock away when we're young, later on, you really realize the implications of just the tragedy or how sad that call was for that family that you worked with or that you saw, as bystanders. And then all of a sudden it just hits you because you just have more wisdom. I always say that wisdom causes gray hair because, man, it is tough. But I'll tell you what, the wisdom, when you can heal from your trauma, the wisdom leads you to being a much, much better first responder than you ever were before, because you can look at people and you can provide them with the kindness and the compassion and the stabilization of their crisis that they need at the time. And your skill level, is consistent with all the years of experience you have. You just become such an amazing provider. But it's really, really important that everybody has an outlet so they can keep all of that in check and keep it all, in that high resilience sort of mode.
That makes sense. I want to talk in a minute, a little bit about what agencies can do to take a better care of their employees. But before we touch on that, how about general public, friends and families of these folks who are in this industry that, have to live with them every day? So as a provider, I may not know I'm in distress, but definitely my wife would know. She'd see the change in me, or my children. So how about for those guys? What can they look out for and do?
I think that the biggest thing to look out for is changes in mood and behavior, and to have those conversations. Every couple has their MO in terms of how much they talk about work or communicate about things that happened at work. And what I would encourage every couple to do is figure out what your MO is, and then sort of know your sort of baseline level of how you guys interact and how the level of discussion you have about work. And then when it changes, it's okay to say, hey, are you good? Because all of a sudden, like, I'm noticing that this is different, or you're more withdrawn, or you're snapping a lot more. And so tell me, have you had a rough couple of shifts, or have you had any tough calls lately? And I think that, every couple wants to work towards some semblance of harmony. I think that the spouses and loved ones of first responders, if they are not first responders themselves, so they have the sort of task of getting used to what it's like for their first responder at work, what it's like to have these constant fight or flight, responses, what it's like to have that parasympathetic nervous system backlash at the end of the shift, and just to kind of figure all of that out. I do strongly encourage family briefs. Tell you what, every time I do a family brief, the family members are like, oh my gosh, that's exactly what happens in our house. And now we know why. And now we know what to do different. And so I think that educating family members on first responder stress and shift work and, all the adrenaline and cortisol and what it does to their brains and bodies is really important, because then it just makes sense.
Yeah, well, that does make sense. And, as for myself, You talked about kind of wisdom as we age, and one of the things that I think really taught me to do things different was learning how to be humble. I'm a Marine Corps veteran and many years in the industry, and just kind of a hard-headed male anyway. And so I think it was even harder for me to admit that I needed help. And so, I think for the caregivers, for the folks that maybe learn how to be humble and realize that you don't have to do it all on your own, and that it's okay to reach out for help. Talk to your friends and family, about what you're going through. I think that's so important.
I totally agree. If you look at all of the training, police, fire, EMS, military, right? It's all about control. Here's what you do. Here's how you take control. Here's how you stay in control. You're in charge. Take charge. Get the job done. And then nobody ever talks to anybody really about what it's like to go through an experience where you can't change the outcome, where you feel the awful word is helplessness. Like, who wants to feel that? But so often with trauma, what people express when we treat their traumas is the feeling of helplessness. And that's pretty overwhelming. And so I think that while we know we can't, we're not Superman, we can't change the world, we can't change the outcome, we can't prevent things from happening. I think the normalization of that is very, very important. I've talked to a lot of paramedics about the fact that, maybe your job for this patient was not to save their life, because obviously you couldn't on this particular event. Maybe your job was to be there so they didn't die alone. And I've told a lot of veterans that too. Maybe your job that day, as a corpsman, as a medic, you couldn't save that Marine or that soldier, but you know what? They didn't die alone. They were right there with them.
That's a cool perspective. Thanks for sharing that. Wow. I'm going to say on the show here that throughout my experience in this industry, I have a huge respect for the women in this industry. They're a different breed. They are tough, and I want to thank you women. I know you've had a tough walk, but I want to ask you, Dr. Glenn, do you see a difference in how the men and women process these things in our industry?
I see a difference in terms of women actually process trauma differently. So clinically, yes, from that standpoint, there are some distinct differences in how women process trauma. And in terms of dealing with the events, you're right. The women have to be tougher, stronger, faster. The expectation is that they can't make it or they can't cut it in this field a lot of times. And so they have to prove that they can. It does make asking for help very tough, because, when you've been through an academy and you're on the streets, and you're constantly proving yourself, it's tough to ask for help. I know when I was contracting with the Marine Corps, I was doing lots and lots of pre-deployment briefs when we were at war in Iraq and Afghanistan. And the guys would come up and talk to me after the brief and ask questions. The females would avoid me until I got in the ladies' room, and then we would talk. It was amazing. Wow. So there's an additional pressure there. And so we'd have lengthy conversations in the ladies' room, but yeah, and then we'd head back out and they wouldn't even look at me. Like, they would not even give me eye contact after our discussion, because the pressure, if they approach me, they look weak. Meanwhile, the guys are, there's 10 of them waiting to talk to me, and it's not a big deal. But for the women, it was very different.
Well, for the ladies out there in this industry, I have to tell you, you've more than earned the respect of your male peers. So I would encourage you to speak up and reach out for help. And I think probably there's more men that can learn from you than you realize. So thank you, ladies, for what you do in this industry. So we've talked a little bit about signs and symptoms and what to do and that. And I think here's where I got it wrong the most, was as a EMS director and having employees that were going through just a variety of problems. And, they end up coming to me for disciplinary action. And, had I been more well-informed at the time and maybe we had a bit better program, maybe better peer support, we could have averted some of the kind of human resource disciplinary issues. What can agencies do better? And what do they need to do to get this right and help their employees and help get these careers back on track and help these folks?
I think that the biggest thing is to have really competent resources in place. I've spent my career sort of training and recruiting good clinicians, good therapists to work with first responders. It's hard to find that. Not many therapists want to work with first responders. I think cultivating good resources in your area, getting local therapists to start to ride along and, have dinner at the fire station and just do those things is a good way to have resources in place. The part B of it is how you respond to people's, the events, the issues, the problems that come up. So often, and my most recent book, which is called Code 4, the thing I challenged leadership to do at the end of the book is to change the conversation, because what happens so often is when an employee is struggling and their performance has declined, everybody in the history of doing this job knows that the tendency has been to look at that person and say, wow, you know what, they've changed. They're a sandbagger now. They're a slacker. They're so different. They're a problem child. And everybody labels that person with whatever they decide they are. And instead, I firmly believe we could be so much more productive if we would pause and say, hey, tell me what happened. Tell me what has changed. Why is this different now? And, it's amazing because probably you've had this experience, my guess is you've had this experience, is so many people get terminated, and then later on the chief or the director or whoever the leadership is, they find out that there were all of these things going on in this person's life, maybe personal, maybe professional, maybe health. And I've talked to a couple chiefs who've said, oh my gosh, if I had known, we could have helped this person. And it's like, but did you ask, right? Because a lot of times, people are afraid to be forthcoming with whatever their problems are, whether it's health or personal or family or whatever. And so nobody ever asks, hey, what's different? What changed for you? And when you ask that question, you'll be amazed at what you get. And there's this layer upon layer upon layer of thing that could be addressed versus just terminating an employee and starting all over again.
No, I absolutely have experienced that. And I think, for me, that I would ask, and sometimes I would open Pandora's box, and, it turns out that a lot of the things they were talking about, their family life was a mess, and they, had a lot of other symptoms that now I see were that they were in distress from the job. And I didn't fully understand it then, or there was a certain amount of folks who would not be very forthcoming, and I wanted to reach out and help or get them into a program. Now my hands were tied a little bit because of the system that I worked in, but nevertheless, if someone would have come to me early on, in particular, I would have gone out of my way to try to get them the help they needed. I think they both share responsibilities there. If you are in distress, you guys need help, please advise your supervisor, let people know, talk about it. Breaking the stigma works on both ends.
Yeah, I agree.
Well, let me ask you, you're talking directly to our listeners, and we're kind of moving through some of these things pretty quick, which, by the way, I hope you'll come back in the future for part 2. What would you say to our listeners that are, even if they're not in this industry, we have a lot of military veterans and folks listening to the program who have gone through their own adversities in life, whether they are in the public safety industry or, have been in the military or not. There's just a lot of people out there that, are hurt and damaged. What would you say to them?
I would say that it is very, very hard to ask for help. And sometimes when you do ask for help, it's like a cumbersome project to find the right person, but to not give up. I think that everybody at some point in their life is going to need some help, and that's called normal. And when you are struggling and you reach out to others and the others you reach out to are not the right answer, just to keep looking, because we have, especially when it comes to trauma, we have such great treatments now. We have phenomenal treatments that are very, very fast and effective. And so I would say, don't give up. Just keep finding that right person. And when you find that right person, I always liken it to, my analogy is that it's like shopping for a new car. You have to test drive a few. So it is labor intensive, but when you find that right person and your instinct tells you that you can open up to this person and that they in fact know what they're doing based on, their credibility and their history and, what their experience is, then it'll be golden. But you have to find that person, but don't give up. It's hard to see these suicide rates, in veterans and first responders. It just kills me because there's so much help to be had, and there's such effective techniques to combat PTSD.
You talked about some of these amazing new treatments and therapies, and I think it's important to hear you say that, because I know so many people that don't seek help because they don't want to be medicated. I see a lot of veterans that are friends of mine. I have a ministry working with folks recovering from alcohol and substance abuse, and so many of them won't seek treatment options because they feel like medication is the only cure, the only treatment, and they don't want that. So are there other options?
Absolutely. Actually, I consider medication the last stop. Like, that's when nothing else is working and we just really have to stabilize somebody. That's when the medication comes in, and the medication is it's gonna calm some symptoms down. But in the counseling process, we get to the root of the problem. My favorite technique is eye movement desensitization and reprocessing, EMDR. And EMDR is a process that actually triggers your frontal lobe of your brain to finally, for the first time ever since the trauma was introduced to you in your life, it triggers that frontal lobe to open the synapses and basically process and download the images that are stuck in your frontal lobe and basically downloads them to your long-term memory. The thing about trauma is what you see, hear, taste, touch, and smell gets stuck in your frontal lobe, and that's why it triggers you all the time. Over time, it becomes PTSD. Well, what EMDR does is it actually gets your frontal lobe to move those images to your long-term memory. Now, I would say this, with severe cases of PTSD, you need to find somebody who's been doing EMDR for a long time and who's very skilled at it. A newer person may not be ready for that, and so it's important to find someone with a lot of experience. But that's been my thing for years. I'll tell you a recent victory. I was teaching at a fire academy, and one of the firefighters, it was actually the day after I taught them, they were doing confined space activities, and he pretty much lost it. He's pretty sure it was a panic attack. So the instructors called me and they said, "Hey, this happened. Can you fix this?" So I came back. Turns out he was a veteran. And he was in a position where he was in a culvert and an IED blew up, and he was trapped under rubble and road and rocks and bricks and all that stuff was basically on top of him. And it took his unit about 2 hours to dig him out, and he was trapped and he thought he was going to die. So when he went to do this confined space, event in his academy, of course, he had this panic response. So I went out to the academy and I did EMDR on him, and he processed through a lot of military trauma, a lot of trauma. And as soon as we were done, he basically, all of those images, sight, smell, sounds were fading to his long-term memory. He was experiencing this relief immediately. So what do? We went out to the training grounds. He suited up, full respirator, everything in bunker gear. And he just climbed on through those confined space obstacles like it was no big deal, and got his life back. Like, that's how well we can fix this. It's not simple for everybody, but man, oh man, what a great technique this is. I'll tell you, the first actual person I did it on outside of my training, my first day of training was the day of the Murrah bombing in Oklahoma City. And 2 weeks later, I'm sitting across from an Oklahoma City firefighter, and he was not okay. And he proceeded to tell me his story. And I said, there's this brand new technique, because it was brand new back then. And I explained what it did. And he's like, "I'll do anything." And I watched this transformation. I followed him through his whole career because he was my first one. And he retired as battalion chief a few years ago with no problems, no symptoms, nothing. So we have this down, and we don't we don't necessarily need to go that medication route, right? If things in your limbic system are massively under control, we might try a course of 6 months of a mild medication to get it to calm down, to help the therapy along. But then we want to pull you off those meds to see if you can do it without it. I mean, this is the last stop. And unfortunately, with everything that's happened, with especially with our veterans, of course, no one wants to be medicated. I wouldn't either. I wouldn't take it either.
Right. Well, that's amazing. Matter of fact, I watched your video on your website, and I have a friend right now that's going through a hard time. He's a retired military helicopter pilot, and I sent that to him, and he said, "I am game." He was really excited because he hadn't heard about this therapy, and so I think it's amazing.
That's fantastic. I'm so glad. I'm so glad. Anything that helps.
Right. Yeah. So as we kind of wrap up, I like to leave our listeners with, just kind of, I know you talked to them, you've covered a lot of ground in a short period of time. If you had kind of one thing that you could leave our listeners to that could really improve the quality of their life to help them through whatever they might be going through right now, what would that be?
I think the biggest thing is when you're facing adversity is to take it one step at a time. And, sometimes change seems so hard and we get really discouraged. And I think that what we do is we get up and we put one foot in front of the other. And sometimes we take a big, deep breath and we look at the big picture. I always tell people to go back to the basics of self-care, your hydration, nutrition, rest, and exercise. But when I say that, I also caveat it with this. Don't do like a New Year's resolution, well, I need to get into shape, because nobody knows what that means, right? What I tell people is if you have quit exercising and you're not on some sort of exercise regimen, I want you to move your body, do what you love, put one foot in front of the other. And so if you love walking your dog, then that's step one, is you walk your dog. Step one is not joining the gym, because that's a setup for failure. Just move your body, ease into things. If you're changing your diet, take 2 bites of what you should eat off your plate and add 2 bites of what you should eat, and gradually ease into it, right? That's the thing, is that somehow human beings expect themselves to be light switches, but we really aren't light switches. We change gradually. And so don't get discouraged. Reach out for help, find good resources. There's so much help to be had. There's so many people who want to help, and to do the best you can each day. And when you have a bad day, it's okay. Tomorrow's a new day. Practice the self-care, get rest, take a night, go to bed early, and just take the breaks that you need along the way to really restore your resilience.
Wow. Thank you so much for that. I appreciate that. That's really great advice. So would you like to share with our listeners, you've written books, you've got some videos, and for leaders out there that may want to contact you and find out how they can help their employees or individuals that are seeking treatment, how they can reach you?
Sure. The best way is my website, which is www.taniaglenn.com. So it's taniaglenn.com. There's a link to the documentary. There's it showcases the books I wrote and gives you all the contact information to reach the practice. It's all right there, and we welcome any questions or any concerns that people need to share.
Awesome. So what's next? You've got all these books and videos. Are you working on anything now?
I don't know yet. Usually what happens is it comes to me, like the third book that I wrote, the most recent one that came out in March, last December, I landed on the runway in Phoenix. It wasn't necessarily a hard landing. I was on a flight and I landed in Phoenix, and the thought popped in my head, oh, this is what I need to do next. So I started writing it December 12th and finished it January 4th, because I'm the kind of person, like, Once I start something, I gotta finice it.
That's nuts, because I'm working on a book right now and I've got all kinds of distractions.
I know. Once I start, I got to get it done. So I am contemplating, and maybe when I land on some runway this fall, it'll hit me that this is what I need to do, or I need to do something else. I am contemplating a book for the family members of first responders.
Awesome.
Yeah, we'll see.
Okay. All right. Well, Dr. Glenn, I thank you so much for coming on the show today. I'm honored to host you, and I look forward to part 2 in the future.
Thank you so much. It was an honor to be here, and I want to thank your listeners too for giving me the opportunity to share the word.
Oh, thank you very much. And again, for you listeners out there, Mind Hostage fans, I hope you'll listen to what she says. And more important than listening, I think, is to put these things into action, to open up and allow yourself the help that you need to heal. Guys, thanks for tuning in today. I look forward to bringing you many more great episodes. If you have a compelling story about your journey through adversity that you'd like to share, please email me at themindhostage@gmail.com. Guys, have an awesome day.